Good afternoon, everyone. I'd like to welcome you to Council Meeting Number 3 for Tuesday, November 25, 2025. And I'll call the meeting to order. Just a couple of little housekeeping items. Councillor Elliott will join in by Zoom if he is able. We have one addition to, and this is not an agenda change, but we have an addition of one person on delegation F1, and we have a late agenda attachment, and this is in L1, Council Information Package Correspondence Number 1 brought forward by myself, and it is a letter from the Caribou Regional District to the Union of BC Municipalities Executive, and we'll get into detail on that. We have a new, I guess we would say a revised and much more diverse and inclusive Indigenous acknowledgement. It's not really formally adopted yet. It's waiting for final approval or final adoption of an amendment to our council procedure bylaw, but I'm going to read it now, and it doesn't necessarily have to be read at the beginning of each council meeting, but it will appear at the top of the agenda, and it is as follows. The City of Quesnel recognizes the long-standing and ongoing connection of the Southern Dakel and Chilcotin peoples to this region, the Latako Dene, Nasco, Luso Dene, and Estala nations. We are grateful to live, gather, and work in partnership with all Indigenous peoples, First Nations, Métis, and Inuit, and we honor their cultures, histories, and contributions to our vibrant community. Now I will look for a motion to approve the agenda with the slight amendment that I described moments ago. Councillor McKelvey, Councillor Goulet, all in favor? Opposed? Carried. Okay, so now we have two sets of minutes to adopt. One is to adopt the regular council meeting minutes of November 4, 2025. Councillor Goulet, Councillor Rudenberg, all in favor? Opposed? Carried. Adopt the special open meeting minutes of November 12, 2025. Councillor Vick, Councillor Runge, all in favor? Opposed? Carried. We have no presentations. At this time, I will introduce or ask the Quesnel Shelters and Support Society to come forward. We have Tammy Janzen, Executive Director, Sherilyn VanHalderen, Shelter Coordinator at Seasons House, Board of Directors, Jolene Pernell, Craig Stenerson, Jessie O'Neill, and Leah Stump, and also the late addition is James Caspersan. He'll be coming in on Zoom. So if you can come forward, and your presentation will be coming up on the screen. Yes, I see it already. So I just love it when a plan comes together. Thank you.
Hi, everybody. Can you hear me okay? Thanks for having us here today. I am Tammy Janzen, the Executive Director for Quesnel Shelter and Support Society, and I'm here with my colleague, Sherilyn VanHalderen. She is the Shelter Coordinator for Seasons House. We're just going to do a quick little rundown of our services that we offer and a snapshot of the homeless count results that was done April 2nd, 2025.
So to access our emergency shelter, an individual simply needs to just come to Seasons House, meet with a case manager, and basically from there we plan an individual case plan involving support, shelters, and meals. So we have 25 funded beds for that program. We have 15 out in emergency shelter rooms, as well as 10 that stay in our common area on the floor. And we also have 10 transitional housing units as well. So those are rental units that we have. Those are upstairs in our shelter, and those are based on availability, and we also do a housing needs assessment, and that is how we decide who goes in those units.
So at Seasons House, we do have somewhat of a day program that's only accessible for folks staying in the emergency shelter. And those day programs, we provide food services, showers, access to laundry, clothing donations, toiletries, and various other things. We also have our take-home naloxone kits so that we can do training with folks and they can have personal kits on them for when they go out and about. We also have the Homelessness Prevention Program, often referred to as the HPP program, and this is a subsidy program for folks who live in community, and we are able to provide them with a top-up subsidy to help keep them housed so they don't become homeless. And currently we have about 30 individuals on that program out in community, and those are to market rentals. And I'd say we probably do about 10 to let's say around 10 emergency subsidies for folks. So if someone comes to us and has a one-time hydro bill or something like that that they're not able to cover, and we can possibly help them out. Or with seniors who their rent is increased or they find themselves at risk of being homeless, we will put them on this program until we can transition them to SAFER, which is another subsidy program for seniors. We have Bridges Supportive Housing. I'm not going to read through all of this word for word, but it's supportive housing. We do not provide clinical supports. These are supports such as connecting you to healthcare so that you can get your clinical supports met, helping them with ministry applications, disability applications, prosthetic applications, connecting them to the OAT clinic, things like that. Staff are on site 24/7 at that site, and there is 20 units of housing and 4 units of supportive recovery, and those are short-term, those 4 units, up to 90 days, and you work alongside Northern Health with a clinician to be in those 4 units.
We also have supportive housing now at the old Grace Inn, which is now changed to Grace Supportive Housing. So there we have 21 units as well, and that is basically the same criteria as with Bridges, same services, and again, no clinical supports being offered there.
So like as I mentioned earlier, April 2nd, 2025, QSSS worked alongside Homelessness Services Association of BC to conduct another homeless count in the community of Quesnel. Data from counts constitutes a benchmark to measure progress made to reduce homelessness over time. The point-in-time homeless count provides a snapshot of people who are experiencing homelessness in a 24-hour period, their demographic characteristics, service use, and other information. Point-in-time counts are an undercount and represent only those individuals identified during a 24-hour period. It's hard to find everybody in 24 hours, so this is why we say it's an undercount.
So our key findings from the last homeless count, we have 131 total individuals that identify as homeless. We have 39 that are sheltered, 92 claiming they're unsheltered. Year over year trend, so a slight increase from the last, we had a slight increase in this last one. So we had 127, and in 2020 was 121. So for Indigenous representation, 59% of those identified as Indigenous, and 88% have lived in Quesnel for more than a year. So we often hear people saying, to tell people to go back to their community or where they've come from, but stats are showing that most of the people are actually coming from Quesnel.
Do you mind if I just jump in on a point,
Yes.
just around sort of the total number there? So, yeah, it was highlighted, the total number increased from 127 in 2023 to 131 this year. But what I think is pertinent is the unsheltered number actually increased by more than that. So in 2023, 74 people were experiencing unsheltered homelessness. So that's not staying in a shelter program, hospital, or transition house. And in 2025, that increased to 92. So that's partly a result of shelter programs transitioning to housing, which is a good story, people exiting homelessness. But I think it does tell a story of unmet shelter need for folks who completed the survey.
Thanks, James. So I thought it was important to review what is sheltered versus unsheltered homelessness. So sheltered is speaking of individuals staying in emergency shelters, transitional housing, or temporary accommodations. They have access to meals, case management, and basic needs. Somebody who's unsheltered, they're individuals living in places not meant for human habitation, such as streets, parks, vehicles, abandoned buildings. This may include couch surfing or temporarily staying with others, and they often lack access to regular meals, hygiene facilities, and support services.
You can go ahead on that one.
Okay.
I'm sorry.
I included this as well just to show an age breakdown of those who were counted. So you can see we have 5 individuals under the age of 18, and I'm going to say roughly 7 individuals over the age of 65 that were counted. And I can just say, speaking from our experience on the ground at Seasons House, we're seeing an increase in age accessing services. I thought it was important to include this as well, just to show that some of the biggest numbers counted were for other services was access to the emergency room and access to food services. It just speaks volumes to the way society or the living expenses, and people just can't keep up when we're talking about the cost of food and living, and it speaks to emergency room access. I find when you're homeless, it's connected to a regular doctor, and making regular doctor appointments, it's harder to do, so you lean more towards the emergency room to access health services.
So we also have on here a list of barriers to housing. So top barriers, lack of affordable housing, low income or unemployment, mental health and substance use challenges, discrimination and stigma. For service gaps, we have limited access to culturally safe and trauma-informed supports. So we have recommendations for action here as well. So expand shelter and supportive housing capacity, invest in culturally safe, trauma-informed and Indigenous-led programs, strengthen partnerships with local agencies, and improve data collection for more accurate counts.
I just want to add to this, our board of directors has done some strategic planning work lately, and these recommendations for action go well hand in hand with our strategic planning. We don't want to see people that have nowhere to go in community, and so strategically we want to try to address those issues and offer supports to people in ways that we can. I believe that we have strengthened partnerships with other local agencies. That's another strategic, we need to work together as a community. No one nonprofit, no one city councilman, no one person is going to solve these issues. We need to work together as a community, and so we really want to strengthen those partnerships. I did add some links onto here, so if people wanted to actually look at the homeless count information, there was handouts if you wanted the 4-page printout from HSABC, and also to the BC Housing and to our website. And happy to answer any questions if anyone has any.
Okay, thank you, Tammy, Sherilyn, and James. I'll open the floor to questions now from council. Councillor McKelvey.
Thank you, Mr. Mayor. I just want to thank you gals very much for the tour. I had a couple, I guess it was, about 10 days ago. It was very informative and very welcoming. Thank you for that. Can you expand on the harm reduction program and how that benefits the whole community, please? Thank you.
So Seasons House operates on a minimal barrier harm reduction philosophies. Well, our entire society, we do. So when you reduce harms for an individual, you are reducing harms essentially for the entire community. If you provide spaces where people can be, it will reduce harms for them. They won't freeze, they won't get frostbite, they'll have access to food and shelter. But it also reduces harm for community. They're not looking for abandoned buildings to break into. They're not lighting fires to stay warm. They're not stealing groceries from the grocery store. So when we talk about harm reduction, I try to think more than just the individual and think of the bigger picture for the community. Did you want to add to that?
I think when people focus or talk about harm reduction, they're really more focused on like harm reduction supplies we give out, like pipes and that kind of thing, when harm reduction is a way bigger picture than that. I know we get a lot of flack and stuff from people, finding needles and stuff in the community. And what I always say, I kind of try to use like a cost analysis for people. I don't have an exact breakdown, but let's say people were sharing needles and someone ends up with Hep C or HIV, whatever the case may be. It's costing taxpayers a lot of money. I don't have the exact numbers, but to cure that or, manage the disease. If people aren't sharing needles and we're giving out clean ones, the risk of, getting disease isn't there. So that is a huge piece that I notice every day at the shelter, I would say. You want to?
Thank you.
Okay, Councillor Goulet.
Thanks, Mr. Mayor, and thanks for the report. Great information in here. I just had a question, of the 92 respondents. It says that in the report 57 were staying with others. Are they still continue to stay with others, or are they just bouncing back and forth? Do we have any stats on that, or are they just going from one to the next, or are they going to the shelter, or are they accessing service while staying with the individual that they're with?
Do you want to take that one, James, or do you want me to?
I was going to offer to, no problem. So this is a point-in-time snapshot. So we ask a question of where did you stay last night? And the response to that is that what you were just referencing. But we also ask where folks had stayed in the last year as a separate question, way later down on the survey. But we do find that there are, of the people who, whether they stay in shelter or not, most people have access to shelter at some point in the last year. So there is some flux in the idea of where people are staying. So just because this number of people were staying safely with somebody else last night, or sometimes unsafely, they're usually not there through the entire course of the year. So this is somebody who's able to stay maybe with friends or family for now, but that runs out. They have to go try staying somewhere else. So they'll stay outside, perhaps an encampment, perhaps at the shelter, wherever else they can find. But we don't know exactly of those individuals because we just did the survey on one day, and they're totally anonymous, confidential, voluntary.
Okay, you're good. Councillor Runge.
Thank you. So I guess my first question, I think, is going to be towards James. James, is there any way to share that raw data of these surveys with us? I'm curious. What I'm curious about is, are the individuals being asked the questions, or is someone else who's caring possibly for these individuals being asked these questions?
So these are all done in an interview format. So what maybe part of or maybe I'll explain just part of HSABC's role. So we're in community on the day of the count, and we work with the team at Seasons House in the lead up to sort of plan the day of. And then we're there to provide a standardized training to everybody who's conducting these interviews. So that includes outreach workers, staff at Seasons House. That also includes peers. That includes organizations, staff at other organizations. So it is a big community effort. It's not just Seasons House creating these data. And then we're there to make sure that that questions are being answered well. If interviewers have questions, we're there to support them. So that answers part of your question. And the other part, absolutely. I think the two folks in front of you there can pass on my email address. Happy to receive an email either from Councillor or from staff. And there's a simple data sharing agreement that we can get together, and you'll get the data directly from BC Housing.
Yeah, because that's, for me, it's really, I want to know how well that survey's taken and if it's actually the same. I actually don't believe it necessarily is the same, but you and I can discuss that sometime with regards to the things I've heard.
Yeah,
it's not a public, I don't. Now, my other question, though, is with regards to, you talked about the barriers that the students have. So this, I guess, goes to, I'm sorry, to Tammy, with regards to the barriers. Do we have numbers? Is that broken up a little bit more? You talked about the general barriers. Is that broken up with regards to, with regards to, number one, the unsheltered, how many are on the couches, or with regards to barriers that they have, how many are mental issues versus other issues, financial issues and things? Are those maybe those numbers are in the data and we can get them from there?
I would say your best bet is from the data from HSABC. Yeah.
Yeah, and I will comment. When we see addiction or mental health as a cause of housing loss, I really try to frame that as that's an unmet health need. So that's a treatable medical condition that if somebody was in touch with the right supports, could actually prevent that experience of homelessness. But yeah, absolutely happy to receive an email, and we'll get that data sharing agreement, and absolutely happy to chat more about this, Councillor, if you'd like as well, at any other time.
Yeah, thank you very much. And just, for our, edification, for lack of better words here, in our report, we didn't have any of this. So we were flying a little bit on the seat of our pants here, asking the questions. So some of these questions might have been researched prior to this. So my apologies if we
totally reasonable
do that.
Okay, now I'm going to go to Councillor Vick and then Councillor Rudenberg.
Thanks, Mayor. Hi, Tammy. How are you? Good. So I guess what I'd like to ask is, I'm hoping we can have the opportunity to work closely on one specific element of your presentation tonight, and your colleague there referenced it exactly, which is the harm reduction supplies, specifically the needle component. And I definitely don't dispute the value and the cost savings that you've illustrated by offering needles to those who may be requiring medical aid instead of a clean needle, and that is not a debatable piece of science, I would say. However, what is clear is that the task of cleaning the needles has largely fallen upon a community initiative funded partially by the City of Quesnel and by Northern Health, and that funding is in jeopardy. And I think we need your help to make sure that funding stream does not evaporate, because I don't want to get into the philosophical debate if the City of Quesnel should be paying for a health service, which is essentially what we're doing there. However, it's clear that that's an important service, and it keeps us safe, keeps children safe who may be playing in playgrounds, et cetera, et cetera. But we really need your help to advocate to make sure that we retain that funding, because that service is important, but I believe it's not appropriate or fair that only taxpayers bear that brunt of that expense. So I'm hoping we can do that. Okay. Thank you, Mr. Mayor.
Can I just say
please,
something
go ahead.
towards that? I openly and gladly would love to work with City Council on trying to secure funds for that program. We agree. Like you said, that is healthcare. It is a clinical support. The fact of the matter is we hand out harm reduction supplies on behalf of Northern Health. It's not our society seeking that out and doing it on our own. It's in support of Northern Health. So I I do agree. I think it's a very valuable program. I think it speaks to community partnerships, and it gives employment opportunities to those in community who may not otherwise get a chance. So I'm very open and happy to meet and see what we can come up with together.
Okay, thank you, Councillor Vic, for raising that question. You've eliminated my question list down to 2 now, so now I'm going to go to Councillor Rudenberg.
I know, it's about being in the line at the right time, because I also had that as part of my discussion with you guys. So thank you for being here this evening. It's always appreciated hearing direct from the source. Just a couple of questions. So the HPP program, you said currently there are 30 residents of Quesnel on the program. Is that sort of a maximum, or is there, it just depends on who comes and asks and what their needs are?
So we get a monthly subsidy amount from BC Housing. I'm not going to say the amount, but it allows for up to $450 per person is the max amount.
Right.
Not everybody uses that max amount.
Right.
If they did, we would have no money left. So yeah, I don't know if that really answers your question, but it's all fund dependent. And sometimes we've had funding, but the housing market, we have unused funds because we can't find a rental.
Right.
So it all depends on market and who you're trying to house, all of those pieces.
Okay, so I don't have to talk about the harm reduction piece. The other piece, and I guess it's more of a, will you see kind of question. So we know that we have a women's building being built with X number of units. We know that we have an Indigenous-led facility through the Friendship Center that's being built. And we know Grace Inn is being built. So knowing that those units, those homes are going to hit the market somewhere down the line, do you see that as opportunities for people to use your services as a homeless shelter less? Like, do you think you'll see them being able to migrate into those various facilities?
So I want to say yes.
I know it's one of those kind of airy-fairy kind of
Yeah,
questions.
I want to say yes, but I'm going to go back to the 2020 information, okay? So in 2020, there was 121 individuals counted, and in the fall of that year, we opened Bridges Supportive Housing. In 2023, we saw an increase in homeless numbers. So
Right. Well, and like you said, when you see it's a point in time, right? Whether you managed to get all of them the year before, was there a change in the economy? There's all kinds of reasons why that happens. I get that. But I really, when you talk about working with partners and whatever, you can see that it's happening in the community, right? There are, there are a lot of facilities being built that will hopefully, allow people to find a home. The last piece, and I haven't had an opportunity to read it, but I did send it to Tanya. I ran across it on LinkedIn, and it's through the Aboriginal Housing Management Group, and they actually have a report on homeless counts for Indigenous people. So it's another one where you can actually go into community areas, I believe, and find out what their numbers are. So I'm not sure if you've seen that report. I can, Aboriginal Housing Management.
So they aggregate the
yeah.
data together from the reports that we've done. So that's a partnership they have with us. So it'll be the same data, the same numbers.
Okay.
They have a way cooler interactive layout. That's for sure.
Yeah, unfortunately, I hadn't had time to actually go into and read it, whatever, but I just thought it was interesting that they actually managed to pull out their numbers. So I guess it's, and they also have some other pieces around housing for Aboriginal databases. That's all I have. Thank you.
Okay, thank you. Anyone else before I ask my 2 little questions? And also, if we can get that PowerPoint shared with us, there's a lot of good information in there, and we haven't seen it yet, so we look forward to seeing it on our own time.
Just for clarity, Mayor, that was my fault, not the delegation's fault.
Oh, I didn't want to mention that, but thank you for fessing up. Regarding the homeless count, well, actually, the question that, or what prompted me to ask this question was in your presentation, you say that you want to improve your data collection and accuracy of data. And I'd raised this question before, that we have the homeless count on April 2nd, and it's only one point in time in a year. And I have to say, well, why not have two, or why not have more? Why not make it more fluid? Because I don't think that, picking one day a year is really representative of the real situation. I mean, picking one point in time really doesn't sort of address changes in seasons, economy, situational, et cetera, et cetera. So I just kind of throw that out there. Did you have a comment on that?
So I really went to bat for this one, Mayor. I kept saying to James, they want to see it later in the year. They want to see it later in the year. So I got pushed back a month. So usually we do them in March. The first two we did in March, and this one was done in April. So I do hear what you're saying, and I do let HSABC know that information, and James is here so he can hear it as well.
Okay, I'm going to extend on that just a little bit more, and that is that you guys are all on the ground all of the time. So there's no one better than you to look to give us an idea, give the community, give the world an idea as to how do you think that is changing over the period of a year, and with economic change, situational change, et cetera, et cetera. So that's something that may be useful. And also on the in the presentation, you noted that you wish to, I guess a goal is to expand on shelter and supportive housing capacity. But it didn't show a number, like what percent, is there a percent, like, or is it just sort of a wish list?
For now, it's...
I might, sorry, do you mind if I just jump in on the last piece, because I want to give this one to these two to close on, because that's a strong one. With respect to sort of the timing of the count, so this is a provincially funded count. 20 communities in the province participate in the count funded by BC Housing and the Ministry of Housing, and those all happen between March 1st and April 30th every year. It is a point in time. One of the strengths of the method in Quesnel, though, is the same organization and the same person have coordinated the count each of the 3 times that it has been done. So it is a reasonable bet that changes and trends in that point in time are a reflection of what's actually happening on the ground. That said, we are happy to support communities as HSABC with implementing counts on other days if they wanted to. It would just require the community, either the nonprofit operator or municipality or somewhere else, to fund just the activities. All of the materials that we have, the survey, everything like that, is all included in the report and public for anybody to use if they did want to do another one a different time of year. And we're also happy to chat about other methods that might be a complement to the point in time count method. And that's an open invitation to Tammy and anybody listening to happy to chat about.
Okay, thank you. And yeah, I think that concludes my questions. Did you have anything more that you wish to add before we get on to our next delegation?
You had asked about like data and what percentage increases we wanted to see when we say we want to expand on supportive housing and emergency shelter. It's basically put it out there and hope that somewhere, somehow it will happen. I just want to let everybody know when we say 25 shelter beds, and once we're full, and there's 131 counted. So, and at this point, there is no secondary shelter, no temporary winter shelter, no warming station, nothing established. And so when we say we want to expand on it, it's because we need to, as a community, expand on it. It gets harder and harder every day to say to people, we're full, you can't come in.
Okay, thank you for that. And I will be honest here. I'm concerned about situations like the 2010 Olympics and FIFA. And, you know, I have to wonder, and I'm sure I'm not the only one that wonders, does that have an effect on homeless counts in Quesnel? Just a question, and I'm not looking for an answer there, but one cannot help but wonder. So we'll leave it there. There's no more questions from council? Well, thank you very much for attending, and we look forward to getting that PowerPoint so that we can peruse it in a little more detail. So now we're going to get ready to introduce our next delegation. I'll introduce them in a moment. Okay, it looks like we got the technology all ready to go, so now we just need the people all ready to go. So I'd like to introduce the Quesnel Safety and Security Committee. This is a coalition of downtown West Quesnel and South Quesnel business improvement areas and the Quesnel and District Chamber of Commerce. And tonight's presentation will be led by Parveen, Pannu, Vice President, Quesnel Downtown Association, and Sandra Lewis, Director of the QDA. So, ladies, the mic is yours.
Good evening, Mayor and Council. Thank you for having us this evening. My name is Parveen. I'm the Vice President of the Quesnel Downtown Association. And next to me is
Sandra Lewis, Director of the Quesnel Downtown Association, and I chair this committee that we formed between the 3 BIAs and the Chamber of Commerce.
All right, so tonight Sandra and I are joined by the representation that is sitting in the gallery with us from West Quesnel, South Quesnel, Quesnel Downtown Associations, and the Chamber of Commerce is also represented in our presentation as well. So we're just going to start off by kind of explaining what a business improvement area is, what we do. We are an association of local businesses and commercial property owners within a defined district who work together to promote economic development and community vitality. We are all governed by a volunteer board of directors who are tenants, property owners, managers, et cetera, et cetera. We mainly contribute through marketing and beautification initiatives, safety and advocacy efforts, community events and promotions, and we also address social well-being. So we support efforts related to homelessness, crime prevention, and urban revitalization. We have the ultimate goal of creating a stronger, safer, and more connected community. So tonight, we are all here united in purpose. All 3 BIAs are here, and the Chamber, and we represent hundreds of local businesses citywide. We are here to collaborate to ensure Quesnel remains clean, safe, and economically vibrant. And together, we are calling attention to the need to maintain and support the city's clean team, ensure full staffing and active recruitment for the bylaw department. So the Clean Team is a citywide asset. There are a lot of members in the community that are not actually aware of the Clean Team, so we wanted to highlight that this evening, and it was highlighted in the previous delegation as well. The Clean Team supports the entire city. Their daily work includes garbage and debris removal and safe disposal of needles and drug paraphernalia. So the Clean Team is a huge resource that local businesses rely on.
Could I just stop you there? Are you prepared to advance your slides? Because
Oh, sorry. I don't know. I was supposed to be doing that. Sorry about that.
I didn't need to tell you how to do your job. But
Sorry, I just
Thank
got
you.
carried away there. Sorry about that. So the Clean Team is a resource that we heavily rely on. You know, some mornings when we go in and there is debris or drug paraphernalia or needles that needs to be cleaned up, we have the Clean Team that we can rely on and call. And there are a lot of businesses that use this service. Without the Clean Team's effort, Quesnel would face a significant public safety and health risk. Our ownership management staff is not trained to pick up these materials. We do not have the means to properly dispose of them, so it does create a risk if we potentially lose this service. Their presence improves not only cleanliness, but also community morale and business confidence in knowing that we can rely on them. We did share the stats in our presentation that we submitted, so we're not going to go too much into those, but we just wanted to share a snapshot of it. So this report that we submitted came out October 2025, and the main months we wanted to focus on were August, September, October 2025 because they were the most recent. In that 3-month time period, the Clean Team collected 1,700 small white garbage bags and 106 large black garbage bags full of debris and other garbage across the entire city, and they safely removed 730 needles. So that just shows kind of a snapshot of how significant this service really is. So as businesses, we've also experienced a large uptake in vandalism and crime that are taking a toll in our community. We have had lots of instances over the last 12 months. As part of the package that we submitted to Mayor and Council, we included letters of support that had some examples of businesses who wrote in and kind of shared their experiences. One example was a hose fitting was thrown through a storefront window. A repair like that costed approximately $2,000, and there were many break-ins in the downtown core in South Quesnel, West Quesnel, that resulted in theft of merchandise over the past year. Insurance often isn't used because it would raise premiums long-term, which is often a point that is overlooked. Most business owners have to make that choice of, do I go through my insurance and have our costs go up long term, or do we, find maybe we don't order stock this month and we pay for this vandalism or something that occurred. These repeated costs can be financially devastating, and a lot of businesses are already under strain. Many business owners are holding on by a thread. The economic climate right now is tough, and having these extra additions just does not make it easy. There's lots of businesses that are facing not making payroll versus, having to deal with all these extra security measures and things like that. That brings us into the bylaw portion of our presentation this evening. The city has funding for 5 full-time bylaw officers, as mentioned in Tanya's report, but only 3 positions are currently filled. One of those positions is a management position, so there is administrative components, and so it's hard to be on the ground at all times in that role. So there is a shortage right now of 2 officers. So this affects response times to business concerns, support for the Clean Team, and enforcement of community standards. There have been a lot of instances, which you probably read in the support letters, where management or staff or ownership is kind of calling in if they're trying to deal with someone who's maybe violent or disorderly and not knowing if they have weapons or things like that. And the response time is quite long, so we're having to figure out how to de-escalate those situations on our own, which is really tough, and it makes it hard to retain staff as well when people are going through stressful situations on a daily basis. We would like to urge the city to continue active recruitment and to be proactive and transparent about filling vacancies. By active recruitment, we know it's hard. We're all business owners, but we just want to be part of the conversation as to, what is being done. Are we doing more than just putting a job posting online? Can we help in any way? Can we hold open houses? Can we help create a package to, showcase anything that we can kind of assist with to fill those vacancies? And the big question of why does this all matter? So the clean team and the bylaw departments are essential to our city's economic stability. Their work helps protect businesses, employees, citizens of Quesnel, maintain public confidence. It makes people feel safe to shop in our areas and to come and spend time in our areas. But most importantly for the city, it helps attract tourists, new residents, and investment. So supporting these teams is not just maintenance, it's an investment into Quesnel's future and our tourism industry. So our ask this evening to Mayor and Council is to help us secure long-term funding for the clean team. It was mentioned in the previous delegation. It is kind of a split between the city and Northern Health at the moment. We are aware of that. We're here with letters of support from 3 BIAs, the Chamber, and many local businesses. We're ready to support in any way that we can to secure keyword long-term funding. The conversation seems to come up, on a yearly basis of, is this funding going to be there for next year? And we just want to find a way that we can advocate to Northern Health to say we need this as a long-term solution. It's not an option. It's a service that is absolutely essential. And then we would like to see the bylaw vacancies maintained and filled to ensure that we at least have 4 full-time officers year-round. And we would like to just continue collaboration between the 3 BIAs, the Chamber, and the city to sustain these vital programs and keep our city thriving. So that pretty much sums it up. We're here, we're committed, and we would like to know how we can make this work together. So we'll move to questions.
Okay, thank you for that. I say this in capital letters, that excellent presentation and the seriousness of this entire situation is demonstrated by the excellence of your presentation and the attendance here tonight of the affected businesses and the business association. So I'm going to open the floor to questions from council. Anyone? Councillor Runge, was that a nod? Oh, okay, Councillor McKelvey.
Thank you, Mr. Mayor. Thank you for the presentation, ladies. My question is to Sandra. Sandra, you are involved with Save Our Streets, SOS. How many businesses are registered with Save Our Streets? And do you see a way that we can all work together to promote SOS to benefit our community?
I don't have the exact number. It's a long list of businesses that have joined the SOS. I follow it. I get their monthly newsletter, and I have since the start. We're not a community that's isolated, and I'm really grateful for them because they advocate on behalf of all businesses to the provincial government and to the federal government, and it doesn't matter who's in power. We're not politically run, or they're not politically run. I really would hope that more people could read the newsletters that I get from them. It's very informative. I love the work that they're doing. And I think it's inspired us to just go forward in more of a positive manner instead of always complaining about the problem. Is we need to work together to find some solutions.
Thank you, Sandra.
And I agree that the good work that SOS does is not getting out there to the public, because it seems like it's getting out there to the affected businesses and the members, but I'll have a little talk with my friend Jess. Who's next? Councillor Vic.
Thanks, Parveen. That was a very thoughtful presentation, and I appreciate the succinctness of your asks. Sometimes when we're presented, there isn't enough specificity in what we can do. I appreciate your specific asks here. We've certainly heard you loud and clear. I also appreciate your linking the health of business to the health of this community. If I've heard you loud and clear that we are in a degree of uncertainty right now, and we must do what we can to help our commercial ratepayers weather this storm. For if we lose the contribution they make, we're in a bit of trouble. So we need to do what we can. So I've heard you loud and clear, and thank you.
I've got Councillor Runge.
Thanks for the presentation, and I do really appreciate it, and I think this is a great way to bring it forward. I really believe that we need to look at ways to fund this that don't just come from that do not just come from the city. You know, if we're sitting here with, you know, it's kind of a catch-22, increase the taxes to pay for this, or are there other ways that the BIAs and the city and possibly other parties can get together to all fund this? I think that's what we really do have to look at. I don't. Like I say, I'm always scared of, you know, reticent to actually just keep raising taxes to pay, in my case, to pay for something that's actually, you know, a health issue that should be paid for by Northern Health in my mind. You know, and this, I guess they're in the room still, but, you know, the supplies come out, and yet we're responsible for picking them up and taking care of them. And there's got to be a way. You know, I think we should have a community discussion with regards to how this is going to be funded. I don't think it should just permanently come from the city. I think possibly BIAs have to kick in, possibly, you know, Northern Health has to kick in, possibly the city. You know, it's just it's a large ask. It's I think a 1% increase in taxes for not including the bylaw, possibly at 2 or 3% when you include the bylaw, and I just feel that that's really going to be difficult this time, you know, at this in this juncture right now at the city, and that's the part that sits. You know, although I value what you're saying, and it was a fabulous report, and the letters were great. They were just exactly what I've asked you guys for. I think this is great. That's my juggling thing. So we want to be honest with it, because, you know, for me, that's what, you know, when it comes to budget time, you know, Councillor Vic will be, you know, we're going to be struggling with this because of all the asks, and I just want you to know that that's going to be a tough one for all of us, I guess. I'm rambling, so thanks.
Did you have a response?
Yeah.
Go ahead.
And I think, yeah, we hear that loud and clear. I mean, in our presentation as well, we're aware that part of that funding comes from Northern Health, and so we're definitely willing to work with the city in whatever capacity we can to go advocate for that funding. And we know things are tight out there. Things are tight budget-wise for our businesses. I'm sure it's no different for the city. But we're here today to basically highlight the service, because I think the Clean Team is something that a lot of the public is not aware of. And hopefully, you know, the public, us, between all of us, we can advocate and get the funding secured is the goal.
Okay, Councillor Rudenberg, did you have a question? You're good?
Thank you.
Okay. Seeing no more, thank you for that presentation. This is a big deal, and we're on it and doing the best we can. But I think that, you know, Quesnel has the wherewithal between, you know, the community and the businesses and the business associations to make this all work as best we can. And so we look forward to working further with you. Thank you. Okay, so now get my papers in order here. We have no items arising from previous special closed meetings. We have no unfinished business. We will now go to committee reports. I-1, November 5, 2025, Financial Sustainability and Audit Committee Chair Summary. Councillor Vic, you're up.
Thank you, Mr. Mayor. Sorry, I got lost in my thoughts there for a sec. So this is a quick review of our finance meeting that we had on November 5th. We dove into two elements of our budget. Specifically, the first, we were scheduled to look at our capital, but we got into such in-depth conversation about the general operating that we actually ran out of time, and we'll be doing capital tomorrow. So nonetheless, we did talk about the city's general operating funds actuals and year-to-date results as of September 30th. And the lens we sort of are placing over this discussion is obviously looking forward to 2026. And obviously we're not ambivalent to the key considerations and challenges within the BC forestry sector. Senior levels of government are giving signals that they're restraining their operating spending, and then the need to be mindful of the affordability for residents and businesses and industry following several years of persistently high inflation, which has obviously been compounded by the rates that we charge in taxation. So it was a good conversation. There's lots more to come. Like I alluded to, we're going to be discussing capital tomorrow, and I'll be reporting that out at the next council meeting. And that's all. If there's any questions, I'll take them.
No questions? Okay, we're going to move on to council reports. And the first two reports are from myself as the representative to the Cariboo Regional Board. Item number 1 is the board highlights from October 24. The Cariboo Regional Hospital District update. The Cariboo-Chilcotin Regional Hospital District nominated and voted for Director Massier for the position of Vice Chair. And on Fire Smart community funding, the board approved submitting a grant application to the Union of BC Municipalities Fire Smart Community Funding and Supports Program for up to $800,000, and that is to continue public education and Fire Smart home assessment programs. Volunteer Fire Department Equipment and Training. CRD will apply for $30,000 per volunteer fire department through the UBCM Community Emergency Preparedness Fund. This grant would support essential training and equipment purchases to improve safety and response capacity, as well as consistency across the CRD fire halls. Ministry of Transportation and Transit Delegation representatives from the ministry provided an update on the Cariboo Road Recovery projects. And now I will go to board highlights from the November 14th board meeting. Board re-elects chair and vice chair for 2026. By reappointing Director Margot Wagner as chair and Director Melinda Neufeld, electoral area E, as vice chair. Bushy Lake sewer feasibility study. In spite of a report coming from the consultants regarding this project, and basically not rejecting, but recommending that the project not proceed based on prohibitively high projected cost. At the end of the discussion, it was agreed that a public information session will take place in the new year where residents of Bushy Lake area, the affected area of Bushy Lake, will be able to review findings and ask questions and learn about the next steps in the decision-making process. We had a delegation from MLA Claire regarding highlights of his work that relate to the regional district. And the board approved submitting a $20,000 Northern Development Initiative Trust application to continue with the business facade improvement program. That concludes my two reports. Is any questions coming from council? Okay, seeing none, now we will go to It's first city staff report, and this is from the Director of Development Services, 374 McLean Street, primary liquor license.
Thank you, Mayor. Sorry, my report was not acting up there for me. With the regards to this presentation, the purpose of the report is to review a proposed new liquor license application for Tea Time Golf at 374 McLean Street, a proposed new recreation business offering virtual golf and seating area. In summary, the applicant is proposing to serve alcohol as a service complementary to the recreation service at Tea Time Virtual Golf with a proposed occupant load of 34 to offer alcohol alongside recreational activities and food snack options. As part of the requirement from the liquor licensing branch, we are required to do community consultation for this. The city can exempt themselves from doing this, but however, then the liquor licensing branch takes over, and it often takes a long time to get through that. So we actually do this so that we can make sure that we do an expedited process, because we know we can be a lot faster at surveying the surrounding community and getting a sense of this. And as you can see from the report, this is a service and use that's highly looked favorably upon by the Downtown Association as well as surrounding businesses. We looked at what's required, and we've provided a draft resolution for council's consideration here in response to the liquor licensing branch. The recommendation is that council approve LQ 2025-01, proposed primary liquor license on Lot 7, Block 13, Town of Quesnel, Plan 17,000, except 17,508, 374 McLean Street, and that council provide comment on the following considerations. The location of the establishment is located within downtown commercial area and will not adversely affect the surrounding properties and businesses. The person capacity and hours of liquor service of the establishment are acceptable for the building size and location. The impact of noise on nearby residents would be negligible, as it is not located near a residential area. The impact on the community, if the application is approved, will add recreation and entertainment for our community and encourage tourism in our downtown core area.
Okay, thank you for that. Anyone want to move? Mitch? Councillor Vick and Councillor Rudenberg. Moving in second. Councillor Runge, you're asking a question?
I am.
Go ahead.
I just have a question, and forgive me, with a liquor license, is that attached to the business or to the building?
It's physical. It's physical location of the business. So both, really.
All right. So I guess the question comes from, should a business ever change? So I don't want to take this one because I'm in favor of this. But if a business were to change or sell out of that building, would that license still be there? Could it be used by someone else, or would they reapply for a license?
It's for that business. So that business at that location.
Thank you.
Okay, I'm glad we got that one sorted out. I had a big question mark in my mind on that one. So anyone else before I call the question? Okay, are we all in favor? Opposed? Carried. And I got to say that anything that has Plan 17,000 in the PID, which is the property identification, that is an old property, and that is the former New Nugget restaurant, which was a favorite hangout of mine and many of my friends in our younger days. So good to see the New Nugget restaurant being recycled again. Okay, now we're going to go to the next city staff report, and this is Council Remuneration Director of Corporate and Financial Services to take this one.
Thank you. This report is just for information. Each year, Council's remuneration, as per policy, increases by the BC Stat CPI for September. So this year, that amount was 1.9%. So I've included in here what the changes to Council remuneration will be. It's approximately a $4,000 change to our budget. So again, it's just for information.
Okay, thank you for that. And as you see, there's no resolution required here. This is just strictly for council information. The next staff report is admin report 4426, City of Quesnel Official Community Plan Bylaw 1979 of 2025 and City of Quesnel Zoning Bylaw 1980 2025. Second reading. Director Turner to report.
Thank you, Mayor. Following our first reading of the bylaws and the public consultation, a few amendments were identified that we wanted to proceed with prior to second reading tonight, and those are listed in the report. There is an Indigenous acknowledgement added to the front page of the bylaw, the same one that's on the front of the agenda as highlighted out tonight. The following amendments have been made to the zoning bylaw Schedule B. There were two parcels that were not correctly updated in the new plan. Those have been rectified. The following amendments were made to Schedule A of the zoning bylaw. That's the text area of the bylaw. There was a need to add a floor area density ratio to the RM4 zone. That was added. Caretaker dwelling unit was added to M2 and M3 zones to make it consistent with all other industrial zones. And a personal care use was added to a few zones there, the C3R, MR1, and the M2 zones. Just identified that was an appropriate use in those zones and it was left out. And that's the totality of the amendments to the bylaw. There, in addition to there being some housekeeping, just text formatting cleanup that was done. So at this time, we're recommending that council provide second reading to the City of Quesnel Official Community Plan Bylaw number 1979, 2005, as amended, and that council provide second reading to City of Quesnel Zoning Bylaw 1980 of 2025, as amended.
Okay, thank you. I will now entertain a motion for second reading to a City of Quesnel Official Community Plan Bylaw number 1979 of 2025. Moved by Councillor McKelvey, seconded by Councillor Rudenberg. Are we all in favor? Opposed? Carried. And now, second reading to City of Quesnel Zoning Bylaw number 1980 of 2025 as amended. Councillor Rudenberg, Councillor McKelvey, all in favor? Opposed? Carried. I just want to say that, I guess in answer to a lot of questions that I get about what's all this densification that's happening. That's not us. That's a provincial government that has basically thrown a wet, all-inclusive blanket over the entire province. And they never really looked at, the dynamics of communities or how the dynamics of different communities differ. So it's something that we are stuck with, and this is all being, in my view, being pushed down our necks, but we have no choice but to comply. There's my little speech. Okay. So we don't have any more admin reports. Council information package, and this was a late agenda item, and I apologize that it came to. I actually said in an email some time ago that I would appreciate this on the agenda, and I guess I didn't follow up on it. So this is a letter, and I think you've all got it in front of you. It is a letter from the chair of the Caribou Regional District, and I'll just quickly read it. On behalf of the Caribou Regional District Board, I am writing to request an explanation. Pardon me, this is addressed to the UBCM executive. I am requesting an explanation as to why the UBCM continues to hold separate engagement sessions for local government and First Nations governments, as opposed to allowing for the opportunity for all parties to meet together to discuss important issues. This was the case during the flood and wildfire review, and most recently with the Heritage Conservation Act engagement sessions. We find this process perplexing and extremely frustrating, given that the UBCM has committed to implementing the tenets of the Declaration of the Rights of Indigenous Peoples Act and the principles of the Truth and Reconciliation's calls to action. In our minds, holding separate engagement sessions goes against this commitment and prevents meaningful and productive interaction between local government and First Nations government representatives. While we appreciate much of the work that the UBCM does in support of local government, it is our hope in this instance that changes can be made. Thank you for considering the board's concerns. We look forward to your reply, and that's signed Margot Wagner, Chair. And I would like to ask Council to consider sending a letter of support to the Chair of the Regional District to the UBCM. If I could get a mover and a seconder.
I'll move that.
Moved by Councillor McKelvey, seconded by Councillor Goulet. Are we all in favor? Thank you. Thank you very much for that. Moving right along now. Bylaws. Oh, we've already done those bylaws, haven't we?
We have correspondence, Mayor.
Just a minute. I'm missing something. I thought that we had just passed second reading to bylaw number 1979. Yeah, addressed under K3, so we don't need to do anything there.
No, but we have correspondence prior.
Oh, yes. I've really been having trouble with sorting out the regional district. That's why this became a late item, because I saw that letter from the regional district and thinking, oh, that was the one that I wanted to bring forward. Yes, there is a piece of correspondence, and Deputy Clerk, I'll have you read that into the record.
The Cariboo Regional District is working with a consultant, Lighthouse, who is applying for grant funding to establish feasibility and business plans for reuse hubs, diversion centers for rural communities, and they're asking for the city's letter of support for that application, and they've attached a draft letter for our reference. Carrie may have more information for you if you have any questions, because she's been dealing with them.
Okay, do we need more information, or are we good to go with that? Are you, Councillor Vic?
I'd like to hear a little bit more, please.
Sure. They've just hired a consultant to start do the research of how they could potentially have repair and what is it called? Reuse, just any way to get waste out of this landfill, right? So to create these centers in the rural areas, and they've just asked for our support so they could potentially do some in the area of Quesnel. This is just the groundwork. It's not actually setting up a center, but to have a grant to be able to do the groundwork to let us know what we could possibly do is a good thing.
So are you saying it's like a diversion strategy, recycling,
Absolutely.
in another name? Okay.
It's another way of getting stuff reused rather than it going into the landfill. Yeah.
Councillor Runge.
So are letters just to support the regional district's ask? Or is there also that bullet contributing financially to the implementation and ongoing operation of the hub?
Yeah, ours is just a support of their ask for the grant. Yeah.
Thank you.
Okay, anyone else before I do? I guess we need a mover and a seconder, right? We don't have that yet. Councillor Rudenberg is moving. Councillor Vic is seconding. Any further discussion? All in favor? Opposed? Carried. Thank you. Again, I apologize for that mix-up. I have no new business, information and question period. Anyone from the gallery? Oh, pardon me. Gallery questions. No, that includes gallery questions. So are there any questions from the gallery? Seeing none. Over the page. Changes to committee appointments. There are none. Announcements and events. Councillor Rudenberg.
Thank Thank you. We all know that Christmas is almost upon us, and if you're looking for an original decorated Christmas tree, please go and check out Christmas Tree Alley at West Park Mall starting from November 22nd through to the 30th. Vote for your favorite tree, then attend the auction on Sunday, November 30th from 2 to 4 p.m. Live auctions, snacks will be provided. It's sponsored by the West Quesnel Business Association, and the proceeds will be going to the Quesnel Seniors Advocacy Program to support food security.
Very good. Anyone else? Okay, so now we go to gallery questions. Are there any? RJ, nothing? You're saving them up, are you? Okay, thank you.
Merry ho ho.
Merry, happy ho ho ho. Okay, so there's no gallery questions, so a motion to adjourn. Moved by Councillor Vic, seconded by Councillor Goulet. Are we all in favor of that one? I'm sure we are. Thank you. We stand adjourned.